Hello, welcome back to the King's Podcast, The Wellness Dive with Lackie. I'm your host, Esther Lackie. Today we are joined by Dr. Gowri Ramanathan. I love her name. Consultant OBGYN and specialist in fetal medicine. And she'll be taking us on a deep dive into high-risk pregnancies. We know there are pregnancies, normal pregnancies, and then there's high-risk pregnancies. And Dr. Gowri is here today to tell us what that is, if it can be prevented, how it can be managed. Dr. Gowri, thank you so much for finally.
It's taken a while.
It's taken a while.
What happens at King's where obstetrics and gynecology and fetal medicine are so busy that
Yeah.
rescheduling our podcast has been a bit of an issue.
Speaking of being busy, how many deliveries do you do a month?
On average, about 20 deliveries a month. On busy days, busy
Wow.
months, 30 deliveries a month, which is quite a lot.
You're seeing all these pregnant women. Are you like on call 24/7, 7 days a week? Do you ever take a break?
So this is what happens with obstetricians. We dedicate our lives to work, but yes, I do take breaks. I try and get uh, some time off, which means a lot of planning, as you can imagine. Telling somebody who's come to you for a delivery and telling them that you might not be there is not always a nice conversation, but yeah, breaks are crucial.
Yeah, but then again, I can assume you have the dates on calendar and all, but sometimes it doesn't work, does it?
No,
Mm.
it doesn't work.
So let's get to high-risk pregnancies.
Yeah.
What's a high-risk pregnancy?
When something within either mommy or baby makes the pregnancy at high risk of going wrong. Now, that can be either mum having a pre-existing disorder, or it could be to do with the babies, whether there's any issues with the placenta, whether there are multiple pregnancies. Of course, the third is lifestyle factors. So women who have got certain conditions or are overweight, that poses a risk on pregnancy.
Are there other external factors, for instance, trauma and that can make a pregnancy high risk?
When you say trauma, yes, of course, physical trauma
Mhm.
can make a pregnancy high risk. There's an unknown of stress trauma as well.
Yeah.
Which is again a very difficult, it's difficult to sort of find research or papers out there on the actual effect of stress on pregnancy and pregnancy outcome.
Mhm.
Stress certainly puts blood pressure up for a woman, so that's a physical thing that we see. And hypertension or high blood pressure is a risk factor for pregnancies.
Apart from stress, what about being mental health? Let me call it mental health. Can it affect?
For sure, for sure. So women with pre-existing mental health disorders, for example, depression, anxiety, they may already be on certain medications. Most of the medications that we use in pregnancy are safe. However, the new onset ones that start developing symptoms within the pregnancy itself, those are a little bit more tricky, and we need to be careful to make sure that we're managing the mental health disorder that's there.
When a pregnancy is high risk, are there symptoms one can look out for, or are you the one who usually tells the lady that she has a high risk pregnancy?
So a lot of women, particularly in Dubai, women are very educated and they sort of know if they have a high risk pregnancy. They come forward and done a lot of research on it. Know, for example, I'm a medication for my depression and I know that's going to have an effect on the baby.
Mm.
I've got pre-existing diabetes and I'm on medication. So a lot of women actually come forward with their own sort of claims of being at high risk because of pre-existing disorders. Sometimes we find it in pregnancy. So pregnancy in itself causes risk factors. For example, gestational diabetes. Gestational diabetes is a condition that occurs purely in pregnancy and reverts completely back after pregnancy. Preeclampsia, high blood pressure in pregnancy, again, is a very pregnancy specific thing. We detect that throughout the pregnancy. with the regular amount of scheduled visits that women have in antenatal periods.
What about a woman who doesn't know that she has a high-risk pregnancy? I mean, what can she look out for? I mean, for instance, I'm here, I'm normal, and I've just realized I'm pregnant, which I'm not, by the way.
You're not pregnant?
Yep, yep, yep.
Most important thing is to actually go see a doctor. When you do get pregnant, go see a doctor. The doctor will do a preliminary amount of screening on you, on your history of anything that might put you at high risk. And then, of course, the baby is assessed as well. So as I mentioned, so women factors, so you may have a pre-existing condition or the baby may have something. So we do certain screening for babies. Now here at King's, we have fetal medicine and I'm a fetal medicine specialist. So we do screening for chromosomes, genetics, we screen for baby abnormalities, we screen for placental disorders further down in pregnancy. So at these different points, if there is anything that comes up as being high risk, then we treat that as pregnancy, and that means a bit more surveillance for both mummy and baby.
So in your experience, Doc, you're experiencing delivering around 30, 20 babies a month. Is there a common cause for high-risk pregnancy?
In Dubai, again, and particularly at King's, we see a lot of women who are what we call a little bit older. I'm trying to be very diplomatic in how I
Yeah,
say.
please, please, please.
I would say probably a third of my patients are over 40. That is in itself a high risk factor, pregnancy, for numerous reasons, risk on mummy as well as risk on baby. Age is probably the biggest thing we see. The second is weight. Women have an increased body mass index or increase in weight. That does put pregnancy at high risk.
Extra weight is always finding its way into the podcast, regardless the topic. I have to ask you something a bit controversial. Is it okay when you hear people call women above the age of 40 geriatric pregnancies?
No,
That's not cool.
not at all. Not at all.
Why? Is it?
You know, every pregnancy, regardless of age. So from an obstetric point of view, we look at the risk factors will increase with age. We all have lives. You have your life. We start our journeys into motherhood at different times in our sort of life, and that's okay. That's okay. The one thing that women who are over the age of 35, which is what we generally call as elderly, that amount.
Elder?
We give that amount of support, but no, there is no labeling to.
Honestly, I find the term very demeaning.
Yes, it is.
It's very demeaning. Okay, moving on. High-risk pregnancy.
Yes.
So now you've diagnosed me with a high-risk pregnancy. How can I manage it to make sure I reach the birth date safely?
The most important thing is to find an obstetrician who deals with high-risk pregnancy, to have a conversation and a plan in terms of what's going to happen. So, for example, if you had twins, you would be, again, it depends on the sort of twins, whether they're identical or non-identical twins.
Wow, in the next podcast, we have to discuss that.
Yeah, yeah, twins are amazing. You would need a regular follow-up, and that's going to be sort of discussed at your early visits with your obstetrician. What can you do about it? Make sure you stay healthy as you can. Avoid lifestyle risks, putting it mildly. So avoid alcohol, avoid smoking, try and reduce your stress levels, and then yeah, just staying healthy. Take your prenatal vitamins that are given to you, and regular visits and don't miss your appointments to the doctor.
Yeah. So you do also regular monitoring of the baby?
Yes.
How do you do this and how often is this done?
Yeah. So ultrasound is the main way of how we assess babies. So I scan every woman at every time they visit. Ultrasounds are safe and there's absolutely no risk in pregnancy. Gone are the days where, we used to, I remember in medical school, we used to carry this little measuring tape.
Oh,
And that's how we measured the woman's tummy to see, if the baby's growing properly by making sure that the centimeters
you
are
can, you can do that?
That's
How reliable is that?
So now we have ultrasound. We see the baby.
Yeah.
We don't just see the baby. We assess the baby. We look at the weight of the baby, the fluid around the baby, the blood flow to the baby. So regular assessments of babies is usually by ultrasound. Later in pregnancy, we use another form of monitoring called the cardiotocogram, CTGs, which looks at the sort of intrinsic nerve system of the baby's heart.
Most of these high-risk pregnancies, there is a chance that they will never reach full term.
So depending on the risk itself, so twins and multiple pregnancies, for example, full term for a twin pregnancy is about 36 weeks. So the majority of the time they are born prematurely. Most of the other medical disorders and high-risk pregnancies do go to term. Certainly not overdue, but we do try and get them as much and as close to term as possible. So the majority of them reach term.
So finally, can these high-risk pregnancies be prevented? Is there a way to prevent them other than telling somebody to give birth when they're a bit younger, when they're not aged below 35 years?
So they are, as you correctly say, they're things that we cannot prevent. Age is certainly one of them. Medical disorders are certainly one of them. But what is important is if you're planning a pregnancy and you do have any issues or medical disorders or medication, optimize that. Optimize it as much as possible prior to conceiving. So preconception counseling and management is important. Diabetes that is well controlled, outcome is very similar to normal, but a diabetes that's poorly controlled, the outcome is not very good. So go see a doctor if you're planning pregnancy. Make sure your whatever disorders that you have are optimized. Stay as healthy as you can. Take folic acid. Folic acid is a single vitamin that helps to reduce the risk of abnormalities in the baby. And yeah.
And don't drink alcohol or smoke. Yeah, but that's a given,
Yes.
The moment you realize you're pregnant, you have to cut all these things off. All right, Doc. Thank you so much for coming in today.
Thank you.
See you next time when we talk about the twins and the triplets.
Yeah,
Yeah?
for sure.
Thank you
very much. Thank you.
There you have it, Dr. Gowri Ramanathan. You can find her here at King's College Hospital in Dubai Hills. Call the number 800-7777 and you'll be directed to her. Until next time, see ya.